Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
All right. Hello, this is Tim Fergestad. Thank you for joining us. Today on the Phoenix Prosperity Podcast, I have Nick Meza, health law attorney, partner at Quarles & Brady, chair of the firm's Phoenix Health and Life Sciences Practice Group. He advises healthcare companies, physician groups, pharmacies, and healthcare innovators on complex regulatory, transactional, and business challenges. Welcome to the show, Nick.
Hey, Tim. Thanks for having me.
All right. So I'm going to dive right into some of the bigger questions, because healthcare is one of the most regulated industries in America. Where do you see the biggest legal and operational risks emerging right now? Because you do work largely on the compliance side, right?
I do, yeah. So, our healthcare group at Quarles, we've got folks in multiple offices that kind of specialize in different areas. Really, my niche area is in the drug and distribution space. So I provide regulatory counsel, compliance advice for drug manufacturers, wholesale drug distributors, pharmacies, specialty pharmacies, and the myriad of entities that support that industry and that distribution chain. So, for me, the interesting piece is not necessarily legal developments, but it's really innovation that is trying to be fit within kind of archaic rules across the country, right? So, an interesting point to that is, Board of Pharmacy regulations that govern a lot of this particular space. They're old, right? These rules are decades old, and we've got clients that are innovators and who are pushing the envelope, looking for new delivery models to increase efficiencies, increase adherence, and like. And so really, I come in where, we've got our clients that are trying to innovate and adopt new models and fit within otherwise archaic regulatory schemes.
So how much of that is updating the overall rules versus changing them and battling them versus navigating them?
It's a bit of both, right? I think, we're lucky in that we've kind of, as Quarles has been within the industry, this pharmacy space for a while, where we've got really great relationships with certainly our clients, but also regulators across the country. And so, many times we'll be brought in to seek waivers on particular rules, or really brought to the table either by our clients or regulators who know that we see, laws across the country, how other boards, other states are doing things, to provide guidance or at least commentary on new rules and new delivery models, and how these boards can really kind of change their rules, kind of meet what's coming down the pipe. Okay.
Let's back up a second for our listener. Why don't you give a little bit more of a background on sort of your focus there as a healthcare attorney?
Yeah. So, I actually started just kind of a bit of background. I am a born and bred Arizona guy.
Native, nice.
Yeah, I am a native, which is a rare thing. Depending on what side of the family you go on, probably fourth, fifth generation Arizonan. My dad's family was here when it was still a part of Mexico. And so we've got some really deep roots here within the state. I went to U of A for undergrad and was really kind of on the pre-med track. I wanted to be a pediatrician. As my interests grew and I was exposed to different areas of study, really, my interest in law and policy grew as well. And so to me, the perfect bridge between those two interests in science and medicine and law and policy was public health. So I switched my degree about midway through, and was having so much fun in Tucson. I tell folks that I decided to get my master's and stuck around 2 more years, and down in Tucson, I got my master's in public health and worked for a couple years after that at a local community health center, Mountain Park Health Center down in South Phoenix, where, before law school, we set up a number of cancer prevention programs. This was before the ACA. So, targeting folks who were uninsured, underinsured, who could not afford cancer screening, and then assisting with treatment if that was the case.
Okay, a lot of great experience that laid the foundation for what you do now.
100%. Just being a part of that industry, knowing the lingo, knowing how things work operationally on the ground from that perspective has been invaluable, right? And so 2 years, I was there at Mountain Park and was sitting on some LSAT scores, and around that time the economy, the Great Recession had hit, and I said, well, this is probably a good time to go to law school and focus on healthcare. So I was that guy in law school that actually kind of knew what space I wanted to be in. I knew I wanted to be within the healthcare space.
Nice. Okay, nice. Okay, so thanks for that. So what do most physicians and healthcare entrepreneurs misunderstand about compliance and risk?
This may go back to kind of my public health days, right? But what's the phrase, right? An ounce of prevention is worth a pound of cure. That's the same on the legal and compliance side of the house. Many times we will be brought in to advise physician groups, oncology practices, specialty pharmacy groups, entities anywhere within the healthcare umbrella. And unfortunately, we're brought in way too far down the road, right? Where we're trying to resolve an issue that if counsel was brought in farther upstream to advise on privacy issues, right? To advise on general compliance operations, staffing models, like scope of practice issues. If folks were investing earlier, a little bit more upstream in just kind of general compliance and guidance on that front, it'd save a lot of hassle and headache downstream at the end. So we always tell folks, particularly when we're engaged early in new businesses, new business models, like the investment up front is going to be worth it down the road, particularly if you're maybe looking to sell the business down the road.
Is that particularly hard for smaller groups to even think about bringing you on or something like that for guidance early in the process?
It can be, right? I mean, I think ultimately we're a large firm, right? We're an AmLaw 200 firm. We sit right outside of the 100 and with 13 offices across the country. But we work, I think, really well with startups, with alternative fee arrangements. We will try to be as focused and narrowed as possible with our engagements to say, hey, you've got a lot of things to handle here, but why don't we focus on your provider contracts? And we can do those in really an efficient manner. And we've done 1 million of those, so we can get them done fairly quickly. So at the end of the day, I think my mentors in my group within our firm have always talked about, we're not here for one-off relationships. We're really trying to build long-term relationships where we can be a part of that business growth and journey throughout the course of someone.
Okay. Yeah, excellent. That's a great spot. It's a testament to the different divisions and ways that QMB can help people. So you work with everyone from pharmacies to the pharmacy benefit managers, is that right? To physician groups, to behavioral health practices, all of it?
Yeah, so with one exception. So we do represent PBMs only in the form of the kind of the vertically integrated models, right? So we will do some work by virtue of the fact that PBMs own and operate their own specialty pharmacies, and they own and operate their own mail order pharmacies. Very rarely, because we represent so many pharmacy entities that are unaffiliated or affiliated with PBMs, we won't get into those payer disputes. Really, when we're doing work, it is generally compliance, and if we're adverse to anybody, it's typically the government, state agencies, and entities and the like. So, but you hit it on the head. It runs the gamut in terms of the entities that we represent.
Okay, and then within all those, what trends are reshaping the healthcare business models right now?
Yeah, so there's a ton. Obviously, private equity is getting into the space more and more. You are seeing a lot of states pass laws that require disclosure of ownership all the way up the chain, particularly with licensed and regulated entities. In my example, pharmacy is the clearest one. So we're seeing a number of clients come to us and say, "Hey, we're being purchased by a private equity group," and there's always a level of reluctance when those groups come in because they don't truly understand, I guess, the regulatory landscape, the disclosures of ownership that in any other industry would seem way too far, right? But within the healthcare space, it's kind of becoming the norm.
Okay. You're in the pharmacy side or just healthcare in general, right? HIPAA and all these sorts of different add-on complications.
Yeah, 100%. I mean, you're seeing, also a number of states that are looking at, corporate practice of medicine issues that might branch into, oncology practices, just broader specialty type services and practices, as well as those practices expand, scale, and get into other areas. So on the privacy side, now we're very fortunate to have folks who kind of operate in that space day in and day out. Certainly as a healthcare attorney, you always know enough to be dangerous, but when you're really getting into the weeds on the privacy side of the house, we've got our own team of HIPAA and data privacy folks that advise our clients on not only the HIPAA layer, but you've got state-specific data privacy laws that are really, really onerous for businesses that are scaling into new markets and new jurisdictions to try to ensure compliance with. So always a dangerous space, I'd like to say.
Okay, yeah, it's super complex. How do you mentioned helping smart operators innovate, right, without crossing legal boundaries? What can you give an example of that, or how you do that?
Yeah. So, we're fortunate. We've got, I like to tell folks, I mean, we've got, our clients are very sophisticated. They got really smart folks in-house. So they're coming to us generally for one of two reasons. It's they don't have the resources to handle whatever question is being posed, or they simply don't know the answer to the question because it is a nuanced or novel business model.
Right. So,
I'm trying to think of interesting models that your listeners would enjoy. We've become somewhat of experts within the space of shared services within the pharmacy space. As businesses scale, particularly pharmacies, with multiple locations, multiple personnel across jurisdictions, they oftentimes seek to leverage personnel expertise, operations across these various locations. States are finally catching up on the regulations that govern that aspect, but in many respects, you might have a pharmacy dispensing in Arizona, but it was a California pharmacy that received the prescription, and you've got remote personnel in Nevada, right, Texas, New Mexico. State laws just don't really address that, and so helping to navigate clients navigate that kind of patchwork and myriad of laws while you're innovating business models that are really trying to seek efficiencies and enhance and improve delivery models. Right. That's always a fun part of my job.
Okay. Yeah, I imagine. Okay. So, bigger picture for maybe our listeners who may not understand, PBMs are pharmacy benefit managers, right? And, correct. Can you talk a little bit about what's happening sort of behind the scenes in a national conversation between drug prices and PBMs?
Yeah. So, obviously that this is after Rutledge, which was a large case, it kind of spoke to, what PBMs can do and how they can kind of structure their networks and payer mechanisms. There's been a larger movement and discussion at the national level about PBM reform, right? Obviously PBMs were brought in as the middleman to help formularies and reduce costs. Pharmacies, that are not affiliated with PBMs are experiencing smaller and smaller margins on their reimbursement. And, a lot of legislation at the federal and state level is targeting PBMs as a reason for that. I think it's multifaceted what's going on with drug pricing right now. But one of the interesting things that we're seeing most recently in Arkansas and a couple other states that have proposed these types of regulations is you're now seeing states pass laws that would prohibit PBMs from having any form of ownership interest in a pharmacy whatsoever, right? And so that, at least in the minds of the legislators that are proposing and trying to pass these laws, would resolve the conflict of interest that many believe that PBMs have in owning their own pharmacies. Now, there are broader constitutional questions. I don't want to get too nerdy on the legal side of the house, but with respect to PBMs that already own and operate their mail order, specialty order pharmacies, et cetera, the efficiencies that they might be seeing with those types of models. What does that mean from a constitutional perspective when a state passes a law that otherwise takes away the opportunity for an entity to do otherwise legal business? And so there are a number of fights that are kind of being lined up right now on that front, but a lot of it is on the state side. And so keeping track of what's going on at the state level is something we do a lot, advising our clients on kind of both sides of that equation.
Okay. That I was a little reluctant to ask. I mean, it's a quagmire for sure. There's so many nuances, good things going on. I had heard that they were trying to get them separated, and it does seem like a conflict. But you dive into it and you realize that there are pros and cons to everything.
There are pros and cons. It is never a clear black and white. Certainly, I do think, with these vertically integrated models, you see a lot of efficiencies that can be achieved and attained, and kind of closed networks and the like. But there are pros and cons to all models, and as attorneys, kind of sitting in the middle of that, just trying to help our clients navigate these complex landscapes. It's job security, I guess, at the end of the day.
Right.
Within healthcare, there's always a question to be asked and answered, and that's what I guess makes my job fun.
Okay. Yeah. In terms of like thinking about the changes that are coming in the next 10 years, I think we have to talk a little bit about AI, not just in the legal space, but in the healthcare industry, right? So can you speak a little bit to what legal and sort of regulatory issues, right, you think are coming that people might be underestimating?
So I think let me speak to the legal side first, then I'm going to jump into what we're seeing on the medical side. I've got some interesting examples that we could touch on, but on the legal side, I think we're very fortunate. I'm very fortunate to be at a firm that it's not shying away from AI. I think we recognize and understand that this will be a tool, a necessary tool. We've got clients that are asking how we are utilizing AI within our practices. We've got other clients that are demanding that we utilize AI in our practices to achieve efficiencies and like. I will tell you some of the tools that we have, certainly Copilot, those are easy things, but Harvey, which is a law firm, a legal specific platform, it's incredibly powerful, but it is still a tool. And so you still need individuals that know how to wield the tool in the right way, not rely on it too much. You're clearly seeing a number of issues on the headlines, in the headlines every other week about hallucinations and platforms making up cases.
That made the news.
I mean, again, we just Google that and there's something new, and judges are slamming firms, large firms, by the way, that are getting caught relying too heavily on these types of tools. So thankfully, we've got kind of some mechanisms in place to ensure that we're looking at relatively, not necessarily closed, but regulated universes where our AI is being employed from the legal standpoint.
Okay. From the legal side now. Well, actually, before we move on to the healthcare side with AI and what people should maybe be thinking about, two things. I hosted a party last week, and one of the attorneys there was like, he's like, I saved 6 hours a day in 10 minutes using AI, right? I mean, the billable hours, right? It can be passed on to the clients as well. But a different friend, their daughter is going to go get a master's or something as a paralegal or something right now. And I was like, I mean, they're using AI themselves, and they're able to do more faster and stuff. But do you see what do you predict in that vein for legal support, those sort of
Yeah.
careers?
So it's scary, right? I've got two kids who, they're young now, but I wonder what they're going to get into. I think I read something like this, like 50 or 60%, it's estimated, of white collar jobs will be replaceable by AI within the next decade or so, right?
Right.
These
Right.
tools are only getting more and more powerful. And so, I do think that there's probably some truth to that, that certain types of legal work may be replaced by AI, maybe the more formulaic type work, right? The
Right.
work that requires review. But I am an eternal optimist. I still think that the human mind still is better than the AI tools. You still need a human to kind of polish the finished product. And at the end of the day, at least in the legal side of the house, this is still a client service industry, right? And so this industry is based on and will forever be based on relationships, certainly ability as well. But until a robot or a computer screen can talk cordially about your children's sports on the weekends, and truly making those personal connections, which are key in the law field. I'm not singing doom or gloom quite yet, but I do agree there's going to be some changes.
You're not seeing anything at Quarles right now? I mean, you're not seeing a little bit of impact with Harvey, or it was Harvey, right? Is the name of the software?
Right.
Yeah.
I think what it's helping us right now do is truly bring in more work, do more work, right? And so, in terms of hiring, I haven't seen any instances, right? I will boast, being on the recruiting committee of Quarles, that we are bringing in our largest summer class in decades since I've been here, right? And so new talent is being brought in, and we're retaining talent as well. I think AI at this instance is just simply helping us do our jobs better. I don't know that
More, better and faster.
Yes, I don't know that, and allowing us to have greater capacity to some extent. I don't know that we've crossed the threshold where we're now trimming positions quite yet.
Right. Okay. Thank you for that. Okay, so now let's talk a little bit about what you envision AI in healthcare and how that in your industry.
Yeah, so we're seeing it all the time. I like to bring up one of the most recent laws at the state level that has been passed, and I think it's an example of where things are going. So Utah just recently passed a law that allows for an AI prescribing platform. So it's run through their state government, but Utah is basically allowing an AI platform to prescribe for chronic conditions prescriptions to patients who may need it, right? And so really taking the practitioner, the provider, out of the mix. Now, there has to have been some form of drug regimen before an initial prescription by a live.
Oh yeah, I'm sure there's all sorts of criteria that they're being very safe with it, but still, that bottom line is they're taking a prescriber out of the loop.
That is absolutely the case. And so, when we talk about issues, for example, of expanded scope of practice, allowing, for example, pharmacists to do more simply because they're one of the most accessible healthcare professionals, in the country, to prescribe on a limited basis, to do all of these other things. When it comes to, these new laws, healthcare professionals need to be at the table, right? And all healthcare professionals, right? Pharmacists, physicians, nurses, etc. Because, at the end of the day, I think AI will also be used as a tool, can help to create efficiencies, but, also, is it going to be taking some of the clinical decision making away from providers and humans? And that's we're at this really interesting interface right now with where that's going.
Right. Well, thank you for sharing that. I didn't know that. When did Utah implement that? Earlier this year?
It was this year. Yeah.
Okay.
So everybody's kind of keeping an eye on that to see where it goes.
For sure. Okay. Good one, Nick. All right. So I like to sort of wrap up a little bit, have a reflection question for you. And what do you wish you knew sooner about wealth, success, your career in general?
Yeah, Tim, we talked about this before we got on the podcast, but I would always heard the importance of your network, right? And I tell this to law students all the time, that you can be told that a million times, but if you don't foster, if you don't water those relationships as if they're a garden, right? Then you're going to be facing some uphill battles as your professional career grows, and you're looking for new business, you're looking for referral sources, you're looking to assist people. So life is so much easier with true, valid, genuine relationships and connections, and your network is much more powerful than I think you realize. And so that is something I'd probably tell myself, even though it was told to me coming up through law school.
Okay. Yeah.
Lean into it even more, man.
I think that's a good one. Yes. I think in this day and age, I don't know how many Gen Z they appreciate online reviews of things. And that's kind of what your network is, right? You can refer different people, and it's somebody who can already sort of vouch for them to some level for their skills and who they are, right?
That's right.
So, good one. Good one. Thanks. So if people would like to connect with you and learn more, where can they go? What should they do?
Sure. Yeah, you could find us at quarles.com, Quarles and Brady. Just Google us. We've got 13 offices across the country. We are a full service law firm. So we've got a specialist in really any area that you might need, probably outside of family law and medical malpractice. But it's an easy, quick Google, and we'd be happy to help if you need help growing your business.
All right. Thank you. Well, thank you everyone for listening and watching. Thank you very much, Nick Meza, for joining me today and sharing your insights into the healthcare legal industry. The overlap of that exciting, complicated, but incredibly impactful area. Thank you.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.